I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing Monday on the federal response to the opioid crisis. The Substance Abuse and Mental Health Services Administration announced last year it will be funding a $30 million grant program focused on drug harm reduction measures. The approved measures include fentanyl testing strips, opioid overdose reversal medication, clean syringes, HIV testing kits, hepatitis A and B vaccines, and other services. Congressman Jamie Raskin specifically asked about the administration's harm reduction approach. Here's the director of the White House Office of National Drug Control Policy's explanation.
Dr. Gupta, addiction is a terrible brain disease, as you have described it. And I believe the administration has adopted an approach called harm reduction, of trying to help people recover from addiction and trying to reduce the other lethal harms of the terrible traffic in addictive drugs. Can you explain what is the overall theory behind harm reduction, and what are the components of it, and how well is it working now?
Thank you, Congressman. Over my 25 years, what I have seen oftentimes is, the only time I will see somebody is when they're dead in my emergency room. I would often see them also reversing and they go away. The fact is that where people are utilizing drugs, where they're using, we're not there. And where we are, four walls of the doctor's office, the hospital, they're not there because there's a lack of trust. There's a lack of understanding. And the idea behind harm reduction is to meet people where they are, engage them, and build trust. And ultimately, what studies have shown is these type of strategies allow us more people to enter into treatment. It allows more people to be saved, meaning in terms of saving their life, and it's cost effective. The administration is embracing proven strategies like naloxone, the antidote, making sure people get an antidote for opioid overdose. Because we talk about counterfeit drugs that are out there in the community now, we are looking at how do you get people to help to be able to check their own drugs to make sure that they're not playing Russian roulette each time they're using those drugs. And lastly, the syringe service program that help us prevent the spread of dangerous, fatal, and very expensive lifelong diseases like HIV and hepatitis. We have gone through a pandemic. We know what an epidemic or an outbreak of HIV and hepatitis looks like, and it's a proven strategy to prevent that from happening. Those are the three aspects that we're in the strategy mentioning, with the goal of making sure we're saving lives first and foremost, and then obviously engaging individuals.
Okay, and is that a policy that most of the states and local governments are participating in along with the federal government?
Yes, Congressman, and it has bipartisan support, and it is one that has been adopted by many state and local governments and have as a result saved lives.
Well, how do you envision the role of the national government going forward in expanding access to harm reduction services? Obviously, we're in the thick of this terrible crisis. Our people are suffering, and more people are getting addicted. So how can the federal government become an instrument of actually getting assistance to our people who need it?
Thank you, Congressman. Harm reduction policies, as a provider and a local health physician, I could tell you, is all about building community trust, bringing all partners together, including law enforcement, to build that trust. The federal government can certainly, and Congress can, of course, provide the resources that are needed for communities to be able to, on a voluntary basis, if they want to pursue these, but also the ability to heal the community through building trust, through connecting people back with treatment and the offering resources that they need to move forward. We have too many broken communities across the nation because of this crisis. And this is another opportunity to do that, just that, with the resources, of course, from Congress.
Okay, thank you. I'll yield back to you, Madam Chair.
Yield back. Mr. Grothman, you're now recognized.